Welcome to The Pursuit of Health, the podcast of Americans for Free Choice in Medicine. I'm your host, Reinier Schuur. Today, Dr. Colleen Smith and I will continue our series on rethinking American healthcare from a philosophical and pro-freedom perspective. Colleen, thank you for joining me.
Thank you for having me, Ray. Happy to be here.
Before we dive into the topic for today's episode, I would like to share a story that speaks to a wider problem that faces advocates for free markets in healthcare. I was waiting for a flight back to America one day when I came across an American couple. We got to talking about the work that I do, that I work in health policy, and they reacted, "Oh, you're going back to America where there's private healthcare and free markets in healthcare?" This is a pretty common conception and reaction that I get when I tell people not only that I work in health policy, but that I've moved from Europe to America. And I think that this is a major problem if you're an advocate for free markets in healthcare, in large part because when people complain about what's wrong with American healthcare, they either blame the free market, assuming that there is a free market, or if they think that it's a highly regulated market, they blame the free elements within it. But if you're an advocate for a free market in healthcare, if that's how people think about it, then you either come across as arguing for the status quo or arguing for the elements of the system that people think is the root of the problem. This raises a deeper question, namely, why do people think America has a free market in healthcare? And why don't we have a free market in healthcare? It is certainly our perspective that America doesn't have a free market in healthcare. And one thing that I've noticed is that it doesn't really matter how many examples that I show to people to disabuse them of this misconception. I can point out how the supply of doctors is in many ways controlled directly or indirectly through government funding, the way that prices and practice are controlled directly or indirectly through insurance by the government. It doesn't really matter. People either think that America has a free market in healthcare or that it is much freer than other countries. But that just simply isn't true. So why then do people think that America has a free market in healthcare? I think it's in part because people don't think that healthcare can be a product of the free market. It raises the question, well, why is that? And there's all sorts of debates in economics that say that it can't be a free market. But I think there's something deeper going on there.
Yeah, I think that's right, Ray. I think people don't see healthcare as something that can be a commodity. And it's not just because they think that healthcare should exist outside of the free market or that the supply and demand that is usually part of what is considered a free market doesn't apply to healthcare. I think it's really something deeper, something that goes more to how doctors see themselves. I think historically, if you look back, doctors really don't see themselves as businessmen or even as people that exist as operating in a marketplace. There are even examples, if you go back to statements from the AMA in the early 1900s, where they specifically say that it's unprofessional for a physician to permit themselves to earn a profit. So I think you're absolutely correct that there's something about how we see medicine as in it just can't be a commodity and it doesn't operate like one, but also there's something much deeper in the way that doctors view themselves.
And if it's the case that doctors either don't see themselves as creating a product that belongs on the free market or that that is not their moral ideal, then that is a major barrier to advocating for free markets in medicine. And if we want to actually advocate for free markets in medicine, part of what that would require is to show not only how there are deep anti-free market roots in how doctors see themselves, but to provide a free market alternative for how doctors can see themselves. And that is what we want to do for this episode today, is to expose the anti-free market roots in the medical profession, how the medical profession prevented the development of a free market in medicine, and how we can draw lessons from this history to think about how we can reimagine doctors as providing a product on the free market. So with that, let's dive in. So it's important to recognize that the medical profession existed before there was a free market. The free market is a relatively recent phenomenon in human history. And even the little business and commercialism that existed before the modern free market came about, a lot of merchants and commercial interests were looked down upon by members of society, which included doctors. Doctors viewed themselves as above the markets. And you can see this in all sorts of ways through human history. There's one example that is notable, namely that doctors couldn't sue for unpaid bills, whereas other professions could, with the thinking that this is not a regular commodity like other commodities. A lot of national and local governments in Europe and in the American colonies had prices set by the government, thinking that this is something that the government should set for the benefit not only for doctors to keep out competition, but for the benefit of patients. And even when governments stepped back and thought, okay, we're not going to regulate the prices that doctors should charge, which happened at a certain point in history, guilds would form or had already formed that took over these sorts of practices to make sure that doctors weren't involved in market activity or explicitly commercial market activity. Which raises the question why? Why did they think that medicine should not operate on a free market? I think one aspect that really plays a key role here is how doctors themselves viewed medicine and viewed the role of money in medicine. And I think the way that they viewed it was that medicine is not a product, but a mixture of art, of study that simply required money such that doctors could render an independent judgment of what was wrong with the patient and what they needed. And the idea was that if you're motivated by money, that somehow clouds your independent clinical judgment. And you saw that in all sorts of other professions that existed before the development of the modern free market. The idea that yes, we want to make money, but money is a means to the end of practicing our craft. And that meant that there was a kind of ideal that developed that in order to practice medicine, not only meant that you needed to treat money only as a means to practicing medicine, not as an end or as an integrated end, but that ideally it should be doctors themselves in a solo practice model where they themselves interact with a patient that was somehow the ideal way of practicing medicine.
Yeah, I think that this comes out of a couple of things that were going on, at least in the United States in the late 1800s, early 1900s. One of them was the existence of all of these different groups, all that were saying that they were doctors or that they could cure your disease. And some of those groups really were predatory. There were people who were making weird concoctions out of alcohol and belladonna and foxglove, all of which are poisonous plants, and then trying to sell them saying that they're a miracle cure for whatever ails you. Those people were often moved around, so they would sell all of their tincture, move to a new place. As people got sick from this tincture, they could never find that doctor again. So I think people who saw themselves as real doctors, whatever that meant at the time, but who were trying to base their practice in science and really doing a job as part of a community where they were building a reputation, saw these charlatans or quacks as people who were giving them a bad name. And so it was really important to them to distance themselves from this group of pseudo doctors who were taking advantage of people and really weren't operating in a way that represented the profession. And then I think the second aspect of that is doctors saw themselves as part of a profession that has an authority that comes with it. And with that authority, and this is sort of an old thing where when you have authority, with authority comes great responsibility, right? And so they felt that this great responsibility that they had meant that they needed to, in some way, differentiate themselves from everyone else. And I would argue that it's not true that your builder doesn't have great responsibility to build you a house that doesn't fall down, right? I think your builder has that responsibility. And just as your doctor has great responsibility to work with you on your health in a way that is conducive to your health improving or staying, or at least maintaining, right? But but doctors really wanted to differentiate themselves from charlatans and people really who weren't good businessmen. They were taking advantage of innocent people. And to do that, I think they overshot by saying, okay, we can't ever make a profit, right? Like we can't ever do things for ourselves.
And I think you're definitely right to bring up the early history of medicine here in both America and abroad. For most of human history, medicine was not effective. And it might have been effective in some small cases, but very often it did more harm than good, and you might have been better off not seeing a doctor. And so it was a relevant fact that doctors did want to differentiate themselves from charlatans. But what's interesting is that while they were charlatans, what they were providing wasn't necessarily always the best thing either. And that started to change with the modern scientific revolution, the discovery of the germ theory of disease. And with that, doctors were able to differentiate themselves more legitimately by saying, we actually do have a better approach that can actually help you. But what is interesting there is that they lump together being advocates of science and going against anti-science conceptions of medicine and healing, and then still keeping the same kind of anti-business perspective that, well, you can trust us because unlike the charlatans, we're not pursuing a profit. We're just as disinterested as the science that we're following. And one of the reasons you can trust us is that, unlike the charlatans, we aren't concerned about profits.
I think this is an example of them going too far because the science on its own and the fact that they were being successful, there was beginning to be some success at treating disease, would have been enough for them to differentiate themselves without this profit piece.
And what that looked like concretely in America was the American Medical Association establishing itself as a professional group, but in many ways it acted as a kind of a guild that used power either directly or indirectly to police the medical profession in both ways that promoted this acceptance and advocacy of a medicine that's based on science, but also policing the medical profession not to engage in overtly commercial practices, which again, they conflated with quackery. And you see this in the kind of positions that the AMA took. They had bans on doctors advertising their services because it was regarded as overtly commercial. They were also against doctors competing against each other on price. There was a ban on doctors holding patents on drugs because it was regarded as too much concerned about private interests and seeking profits for one's work. And there was also a explicit ban on non-physicians making a profit off of the labor of a physician, which meant in many ways that you couldn't have real capital formation in healthcare like you had in other industries like engineering and electricians. It was only the capital that doctors themselves could accumulate that could be used to invest in growing a business in medicine and therefore the whole medical industry. And one way that the AMA enforced its views was through state medical boards, which had the power to give and revoke medical licenses, without which doctors could not practice medicine. And the AMA did do this. They went after doctors who engaged in what they regarded as unprofessional behavior, which in many cases meant engaging in behavior that many other professions did in other industries, like advertising their services, like competing on prices, like having patents in engineering and other areas where professions applied the power of science to meet human needs. But they also advocated at the state level for certain laws, such as bans on what's called the corporate practice of medicine, which simply means that doctors were not able to form organizations with non-physicians to deliver medical services, which again limited the delivery of healthcare to physicians alone and kept out any non-physicians in terms of capital, in terms of expertise from other industries and professions from developing new ways of delivering healthcare. And what this meant was that the American people was very much confined to the solo practitioner model. Yet, as healthcare kept getting better, the demand for healthcare kept increasing. But this solo practice model simply could not keep up with the rising demand.
Right, it was getting too expensive.
Exactly, which is
Right.
relevant today as well. That's not a new problem. And so what started happening really out of economic necessity, both for patients, but also for doctors who were actually not able to make enough money through the solo practice model, was the formation of different kinds of models that either went against or teetered on the line of what it was acceptable for the AMA.
I think it's relevant here, though, to say that it's not even just doctors weren't able to make enough money, because we're talking about we think doctors should be able to make a profit, but it's that doctors weren't able to make enough money to offer the services like x-rays and vaccines and medications that were being invented so that they could offer appropriate care to their patients. They couldn't keep up with the technology because they couldn't even make enough money to do that.
And so we're not going to give a comprehensive list of all the different models, but just a few examples. One way that doctors were able to provide more affordable care to more people was by contracting with so-called fraternal lodges, which were really certain associations, often aligned with a particular religion or ethnic group, where for a certain amount paid per person, they were able to deliver healthcare for a large group of people in a way that was affordable for those people. Another way that they were able to offer their services to a larger group of Americans was by working with a particular company. One notable example here is in the railroad industry. There were called railroad physicians who provided medical care for both employees and customers in the railroad industry.
I think one thing that's really important to mention about some of these early models, like the lodge model or the company models, is that in effect, this was a form of health insurance. This was the lodge, for example, would pay $2 per person per year to the physician, to the doctor, who then would take care of everyone in the lodge. And certainly some people in the lodge would need health care and other people would not during that year. But it was health insurance in the sense that it was a large group of people with a somewhat adjusted risk, a variable risk from person to person. And if one person cost a lot of money, but other people cost less money, that risk was balanced out and the cost was balanced out over the amount of fee that was paid by everyone throughout the year. The other kind of practice that we want to talk about is the development of prepaid group practices. So, as physicians began to specialize, as technology became better and we learned more and more about how to take care of people, in particular, we began to develop specialists in radiology with the advent of the x ray, and specialists in ophthalmology, and obstetrics developed a specialty. And the AMA was consistently saying the primary care doctor should do everything, but it became increasingly clear that some doctors were better at certain things than other doctors. And if they joined together, they could take care of a large group of patients in a more comprehensive way. They began to join together. So, some early examples of this are the Mayo Clinic, which on its own became well known for surgical innovation and surgical success and low complication rates, such that people would travel from far away to go to the Mayo Clinic when they had complicated problems. The Mayo Clinic ended up with some hundreds of employees, doctors and laboratory technicians and janitors and other people helping them to create this system that allowed patients to prepay into it and get care, or to come outside of the prepayment system and get advanced medical care that they couldn't get elsewhere. Similarly, other prepaid group practices, which were smaller, it turns out there were hundreds of them. When the AMA and the government kind of looked into how many prepaid practices there were hundreds of these small prepaid practices, which allowed patients to pay a small amount. It included some amount of their medical care. And if they had to leave the practice to go out and get additional care, they may be paid more. But the incentives in that sort of thing were balanced. It offered patients integrated care at prices that worked for them. The patients maybe didn't need to use the entire amount of care that was available to them, but that money that was provided to doctors allowed them to offer technology and services that they would not otherwise have been able to offer.
Yes, exactly. Another thing that I think is worth noting about group practices is the way that they paid physicians was a certain kind of innovation that aligned profit seeking much more with health than the traditional fee for service model. Because uh, there were, of course, ways in which patients could seek highly specialized care in the hospital, but even in that setting, doctors would be paid on a fee for service basis. And if they were given a salary, then very often the AMA would object to that as well. But in these group practices, often what they did was offer a base salary to the physicians and to give the physicians a certain amount of the profit of the company at the end of the year. And what that created was a certain kind of incentive where doctors realized that if they undertreated patients, that the patients could get sicker and might require more expensive care later on, which they would have to pay for under the contract that they signed with the patient. Or they would risk losing the patients to another practice by referring them outside of the practice or losing them to another group practice. But another thing that it did was it incentivized against the overtreatment of their patients, which you often see in the hospital system, where doctors might have an incentive to err on the side of giving a treatment even though a patient might not actually need it.
And that's actually one of the major problems that we face today, where doctors don't know what anything costs. And while you might think that doctors shouldn't know what things cost because then they'd be less likely to do something for a patient that needs to be done, in fact, it's when doctors don't know how much things cost, they often do more than needs to be done. And there's a real risk to that too. For example, one thing that happened for a long time in the US was that men were getting prostate specific antigen testing done all the time. Then these men would have slightly elevated PSA levels, be sent to urologists who would do a prostate biopsy. Many of these men didn't need a prostate biopsy. All they needed was maybe a couple more episodes of having their PSA tested to make sure that it was staying stable. Some subset of all of these men who had prostate biopsies that they didn't need ended up getting real long-term complications like urinary incontinence, urinary strictures, meaning that they couldn't urinate and would have to have long-term catheters placed, all sorts of complications that never would have happened had they not had this PSA test sent that may or may not have been needed to be sent, and then been sent to a urologist and gone on to have a prostate biopsy that they didn't need to have. So over-testing is, I think, is as much of a risk as under-testing in many cases. But when doctors don't know how much things cost, they can't calculate that into what they do. And they're often incentivized to do more without having any sense of what the long-term risks are.
Exactly. And I think what the group practice model therefore shows is a kind of rebuke of the AMA conception of the role of money in medicine. Because the AMA thinks that money is a means that we can practice medicine. The group practices showed that thinking about money in some cases can make it the case that you're able to practice medicine better for your patients. And in the group practice example, it shows an integration of the profit motive and clinical judgment because the doctors were incentivized to maintain the health of their patients because doing so was profitable, because they had created the right incentives for those two things to align.
And you might ask my prostate biopsy example, well, why didn't more doctors just not do the prostate biopsy and follow the PSA? And the answer is because it was one of a few procedures that had good reimbursement rates for Medicare and Medicaid. And so as long as the PSA was a little bit high, doctors knew they would at least get reimbursed, which is a misalignment of incentives.
Right, because they would essentially lose potential money if they didn't bill for that. Whereas in the group practice model, because they had the freedom to innovate, they were able to more closely align the pursuit of health for their patients and the pursuit of profit. But what's interesting is that this group practice model came about really out of economic necessity and not out of any ideological motivation on behalf of doctors to pursue free markets in medicine. So in many ways, they were non-ideological. And what's also interesting is that most people outside of the AMA recognized that these models were economically superior to providing affordable healthcare compared to the solo practice model. And there was even a government commission that, after lots of study from different groups, recommended group models as the basis for reforming the American healthcare system.
Yeah, I think you're talking about the Committee on the Cost of Medical Care, which was given a grant to study US healthcare and the various ways in which US healthcare was being provided. And they brought together not just medical leaders and prominent physicians, but also public health professionals and academics. And together, this whole group, physicians, academics, public health professionals, came together and issued a report in 1932 recommending these prepaid doctor groups because they both offered integrated care at reasonable prices, but also appropriately incentivized that care in such a way that doctors were able to make money, but also were not taking advantage of patients, and that the incentives were well aligned. However, as soon as that report came out, the American Medical Association responded basically by calling them socialists, stating that they were inciting a revolution. And at the time, there was this big fear of socialism because everyone was looking at Germany, and this was pre-World War II, and Germany had just switched to a government managed healthcare system, which everyone was afraid of. And so the AMA kind of weaponized this report, turned against the Committee on the Cost of Medical Care, which they had backed initially, and didn't listen to anything they said, and proceeded to work to shut down all of these prepaid doctor groups.
And I think it's worth considering why they were afraid that these group practices would lead to socialized medicine. Because on the face of it, it looks absurd or even confusing. What they were really saying was that the way that group practices would lead to socialized medicine is precisely because these group practices more effectively and efficiently organize the healthcare market, such that if there was a move to socialize medicine, it would be a lot easier. Basically saying that it would be a lot harder to socialize medicine if we maintained the solo practice model, which is very telling. There's a kind of a recognition that, yeah, we know these models work better, but we don't want to pursue them, not only because they will lead to the prospect of more government control, but they were also on principle against these group practices because for them it smacked too much of a commercial free market approach to medicine. That's what they objected to. So it's not merely that they didn't want them because they would lead to more government control, which they feared and they regarded as a threat to the doctor-patient relationship. Their whole view of the doctor-patient relationship is a clumping together of good and bad conceptions. On the one hand, you might think that, yeah, having a doctor-patient relationship is valuable. But what these group practices showed was that having other people involved in that relationship in the background or even directly greatly enhances medical care. But the problem with that is that that is a kind of industrialization or corporatization of the doctor-patient relationship. With the AMA, wouldn't have. They objected to it on moral grounds because for them, that brought too much of a commercial incentive and profit motive to the relationship between doctors and patients.
Absolutely. In fact, the AMA also objected to it, again on commercial grounds, because it set doctors up to compete against each other. And I would argue that doctors should compete against each other. That's part of what keeps doctors honest, what makes them continue to work to do a better job. As a doctor, I'm a professional and I want to do my job well, but that competitive spirit also helps push people forward, helps them innovate, helps them come up with new ideas. And the AMA was very much against this. They were terrified that doctors would be pitted against doctors, that corporations would be pitted against corporations, competing for the patient to what? Competing for what? To provide better medical care? I mean, that's really what they would be competing on. But I think, again, this is this idea that the AMA thought that any corporatization, any competition would detract from the professionalism, the authority of the profession, of the job of being a doctor. And I think they were wrong.
And the AMA did not only reject this commission, they again used their real power through the state medical boards, which was mostly populated with AMA members, to go after group practices by threatening their licenses or even revoking their licenses, and to socially chastise members of the medical community that if you join a group practice, you cannot rely on your colleagues to step up for you if, for example, you're being sued for malpractice or all these other benefits that were associated with being a member of the AMA. They would keep those benefits from people who pursued these alternative models.
Yeah, they actually explicitly threatened young physicians in a 1934 JAMA editorial. They said the young physician who is tempted by the offer of some commercial agency to enter into such schemes of combinations should bear in mind that he thereby jeopardizes his entire future in the practice of medicine and sacrifices the medical birthright for which he has already paid 6 or 7 years of his life. Close quote. That's an explicit threat that was published as a 1934 editorial in the Journal of the American Medical Association.
So I think it's important to take a step back and ask ourselves, how did the AMA manage to win this fight against the group practices? Especially given that all these other groups were in favor for group practices, clearly had the economic case on their side. It was a slam dunk on how much better they were. How then did the AMA manage to defeat them and preserve the solo practice model for physicians? I think one of the answers here is that they had the moral high ground. They had a conception of the medical profession that they had sold a lot of not only other doctors on, but the public on. That in order to have a proper relationship between a doctor and a patient meant keeping out third parties, whether those third parties were corporations or the government. And also importantly, the advocates for these group practices formed them out of economic necessity. Again, not out of any kind of intellectual or ideological conviction that having the freedom to develop alternative models for financing and delivering healthcare is a moral good. So even if they could have made more convincingly the economic case for their models, I think that they were bound to lose because they didn't have any moral arguments on their side.
Right. They had no moral arguments. And at the same time, there was this fear of socialism that the AMA was able to capitalize on. Probably most of the doctors who were part of these associations also feared socialism because everyone did. So the AMA was able to use that fear of socialism to play off of the fear of ultimately these associations of physicians becoming government organizations. And with no moral argument for free market or for freedom of exchange between patients and doctors or doctors and doctors, even, there was no way for them to stand up for themselves.
And the last thing I want to say on this that I think is relevant for our wider project of rethinking healthcare is that not only did the AMA prevent the development of alternative models for financing healthcare, they prevented our imagination in rethinking different relationship between doctors and patients and confined the medical profession and doctors in particular in how they can think of themselves. They're basically told that this is what it means to be a doctor, and if you stray outside of it, you're unprofessional, you're unethical, you're not a good doctor.
Yeah, and we see those things carrying over into medicine today, into the way doctors view themselves, into the way many doctors think that they have not just an obligation, but a duty to their patients, even at the expense of risk to their life, which we saw during COVID, or risk to their finances, which we see every day. But we are starting to see people coming up with new ways to practice medicine. For example, direct primary care has been kind of a new movement in medicine that has started to make some headway, and it really is a situation where patients and providers, doctors are better able to choose the terms with which they engage.
But while the AMA defeated the group practice model, the solo practice model was unsustainable. It could not actually meet the growing demand for healthcare in America. So something had to change. And as we'll discuss in our next episode, where um, advocates of explicitly socialized medicine tried to make healthcare more affordable, how the AMA tried to defeat socialized medicine and why eventually they necessarily had to fail that fight, given the groundwork that they had laid for themselves in their fight against free market medicine. Till next time.
Till next time.
To stay up to date on our newest episodes, subscribe to our show from whatever podcast platform you are listening from. To support our show and Americans for Free Choice in Medicine, you can make a financial contribution at www.afcm.org/donate. Thank you for listening.